Dry needling is a treatment utilized by the medical community to treat acute injuries, subacute injuries, chronic pain. Very effective in treating athletes that are training for competitions, or especially for runners that are putting lots of hours in, a lot of repetition. Runners usually have an area or two that may be a little bit tight or a little bit painful, that will limit their training, that will limit the time that they can spend running, or at least limit their time running comfortably. And I think it's an area of frustration for a lot of runners that, maybe cardiovascularly they're in shape to run a little bit more or train a little bit harder, but their body's not letting them do that. And if we can reduce your pain and let you train a little bit longer, again, it's going to get you better results. And we'd like to try to take out that aspect of, gosh, I hope my knee's going to hold up for this run today, and you can start focusing on more important things like your training, like what you're going to do to train that day, instead of whether your body's not going to be able to handle it. Needling is great for recovery after an intense workout, after just an average workout. The needle itself increases the circulation to a muscle. So when a muscle has been fatigued or chronically tight, it doesn't get the same circulation as healthy tissue does. And when you can get that increase in circulation, it's going to speed up your recovery time, because that excess oxygen, excess blood flow that's going there is going to bring more oxygen, which promotes that healing. And so if we can get you in a day after a big run or a big training session, we can usually cut down your post-run or post-train soreness quite a bit. I think for new runners it's really important because it's a patient that you'll often see that has just started to run increased distance, or started to run maybe a few extra days a week than they used. And I think that they tend to find that there's an area that starts to become a little more painful, or they're starting to notice some more tightness, and that limits their training. So if we can keep them, again, keep their body balanced, keep them comfortable, the training process is a little easier for them, and they're less likely to get frustrated. Several common ones would be, the chronic knee pain, patellofemoral syndrome for some of the runners, where they have issues with their kneecap. Hamstring tightness, maybe some pain in the back of their knee or the back of their leg, where they always feel tight. It might limit their run. Calf pain is another common one, where just right in the middle of their calf they have some soreness. It never feels like they can quite stretch it out enough, or their pain will just be enough to limit how much they can run. And then also hip and low back symptoms are very common amongst your runners that run for distance. If you're feeling better, it's a really good chance to reduce your time, because in order to reduce your time, what's some of the important things are your training, being able to give it 100%, and you can't always do that when you're injured or having pain. And if pain is keeping you off the roads or off the track and limiting how much you can run, it's challenging to increase your time that way. At the time of your first treatment, you'll come in and I'll do a full evaluation. So during an evaluation, we'll check out your range of motion, your strength, not just the area, say you're coming in for your knee. We're going to check the knee out for sure, but also the areas above and below, because your body does function it's going to function better when it's balanced. And so we want to make sure there's no areas surrounding it that are maybe a little weak or a little bit tight that could be affecting above or below your affected area. After the evaluation, I'll talk with the patient. We'll establish a plan of care. It's very important to find out what the patient's goals are, because that's why you're here, and see whether it's pain, whether you want to run a little bit faster, whether you want to become a little bit stronger. We'll establish those goals and then start working from day one at achieving those.